Nehawu has blocked the Eastern Cape Health Department from using the no work, no pay rule for EMS staff. It's also been ordered not to make any salary deductions as well. Now, to remind you how we got here, over 200 paramedics were accused of being on strike despite reporting for duty. The medics say they were not able to render services as ambulances did not have proper equipment. Well, it's a very, very complicated story, and luckily we have now gotten some clarification. But let's speak to Nehawu on the blocking of the situation. I'm hearing from Lwazi Nkolonzi, the union's national spokesperson. Lwazi, good to have you back on eNCA. Let's just find out where we are about this. So you are blocking this. Explain to me why.
Good morning, Gareth, and good morning to your viewers at home. As Nehawu, Gareth, since April 2022, we have been embarked on a process of entailing that the Department of Health complies with the OHS Act and the EMS Act by providing adequate tools and equipment, especially with regards to the ambulances that are carrying out the duties of providing services to the communities of the Eastern Cape, especially rural communities. Instead of the department providing the necessary equipment, they embarked on terrorizing our members and victimizing our members. And just recently, the department had embarked on a process of instituting salary deductions and implementing the principle of no work, no pay. As a result, we then approached the labor court for an agent interdiction, citing that the department cannot embark on that process. Bearing in mind that our members have been wrongly fully accused of being on a strike, of which the department had in fact in June confirmed that our members are not on strike in a court process. So we then interdicted that process, and the labor court judgment came out on the 17th of this month. And gave us that judgment that says that the department cannot deduct salaries of our members. And that's where we are currently at the moment. And we are fighting that can the department at least just do basic, simple things of adhering to the EMS Act, adhering to the Occupational Health and Safety Act, and provide our members with the necessary equipment and tools to carry out their duties diligently so, and save the people of the Eastern Cape and provide critical emergency services to the people of the Eastern Cape and the rural communities.
It does beg the question as well. It almost comes across, Lwazi, tell me if you agree, it comes across as quite uncaring from the Eastern Cape Health Department. One, simply not providing the equipment to do the jobs. We're talking about basics. We know what an issue this has been. We know how seriously affected residents in the area. This story going back months now, and then coming out and saying no work, no pay as well. Some people are suggesting it's, in some cases, intimidation and bullying and uncaring from the department. Would you agree with that?
Precisely. We fully agree with what we have just alluded to. And that's what we have been subjected to for the past months, that the Department of Health in the Eastern Cape, instead of fixing the challenges that confront health, it's not only the EMS issue, but there is historical challenges facing that department, has gone and embarked on a process of intimidating our members, charging our members, and victimizing our members. And they've used even court processes to victimize our members. And this highlights to us that the Department of Health in the Eastern Cape does not have any aspect of caring for the people of the Eastern Cape. It does not care about the workers that on a day-to-day basis render quality services to the people of the Eastern Cape.
Help me understand in the last few moments that I have with you, Lwazi, because I think many people will agree with you just based on the last two actions. One, not keeping the supply of equipment in check, and then this no work, no pay deduction that they were attempting to do. What happens now, though? Are we back at work from today, or what is the next step? Just my last question to you. What happens next?
Our members are still working, but this is what they are doing, Gareth. They've invoked the OHS Act, which allows them that if they are faced with the conditions that are dangerous and put their lives at risk and those that they are rendering services to, they can invoke that act. And that's what they've been doing up until the Department of Health resolves the challenges that are faced by our members. Our members are going to continue along the path that they've continued up until we get the Department of Health to do what is quite correct and necessary, providing necessary equipment and fitting those ambulances with the proper equipment to save lives of the people of the Eastern Cape. That's what we're going to be doing currently.
It beggars belief why you even have to ask for the basics to save people's lives. It's something you have to ask for from the Eastern Cape Health Department. Lwazi, of course, we're going to follow this up and see what happens over the next few days. It's all about healthcare and allowing EMS to simply get on with their jobs. My thanks to Lwazi Nkolonzi, Nehawu's national spokesperson, joining us here on the SA Morning.